widely available. If you find yourself struggling with the decision to receive a vaccine, please understand your decision impacts not just your own health, but the health of others, the health of my children and yours. As a physician, I have had many conversations with my patients that have led to their accepting the vaccine despite significant concerns. It's important to take time to discuss your concerns with your trusted clinician. We all want to have these conversations with you. We have seen what this infection can do, and we care about you, keeping our patients safe. When I'm at the hospital and in clinic, my job is to care for my patients. As a legislator, my job is to care for my constituents in my state. It is my duty to leverage my expertise in the medical field to advocate for policies that will protect people. Policies like universal indoor masking. We are fortunate to live in a time of unparalleled scientific knowledge and discovery. As our understanding of how to combat this pandemic evolves, so must we. We, as lawmakers, must be willing to adapt our positions and our policies to the science, with a common goal of preserving the safety and health of all. Today, that evidence shows we urgently need to mask back up. As we continue to navigate these unprecedented times, we need national, state, and local leaders to rise to the occasion, like leaders here today in Multnomah County, to follow the science and to implement and voice support for safety measures like masking and vaccines that keep communities safe from this deadly virus. Thank you.
Thank you, everyone. And
the speakers national, want to start state, and local leaders to rise to the occasion, like leaders here today in Multnomah County, to follow the science and to implement and voice support for safety measures like masking and vaccines that keep communities safe from this deadly virus. Thank you.
Thank you, everyone. And if the speakers want to start their videos, and everybody can just jump on, I'll kind of change this format here so that it's in speaker view. And we've got a list of folks who would like to ask some questions.
All right, you were just listening to a news conference with Multnomah County health officials, leaders, even school officials there saying, yes, Multnomah County, we need you to mask up again. They will be requiring masks in all indoor spaces starting this Friday, August 13th. Again, that's an indoor mask mandate for all indoor public spaces in Multnomah County starting on Friday, August 13th. We'll continue to follow this, give you all the details coming up at 4 o'clock. You can also stick with us for continuing coverage on kgw.com and our social media pages.
And food. However, water is not so easily available. So Hyrax performed their first act.
And of course, they're going to show an ad before they're going to let me watch a freaking live press conference.
Schools are a place for care, connection, and learning. During this anxious time, as schools return full-time and in person, you may have questions about the health and safety plans of your district. Find the answers at oregon.gov/readyschools.
An immediate tool that we have available. We would rather not issue fines. We would rather not have people turn it into, self-policing their neighbors. But we want to be clear. Apparently, when we made the recommendation, the very strongly worded recommendation at the end of July, people didn't get the message. We need people to wear their masks indoors, regardless of whether they're vaccinated or not.
Okay, thank you.
Simon, you wanna?
Yeah, piggybacking off of that, you mentioned enforcement and the potential for fines. Is there a mechanism for that? Will this be through county public health? Will this be through some kind of a partnership with OSHA?
We are going to utilize a similar mechanism that we do with our tobacco and retail enforcement, and we will have the details of this out released on Wednesday to the public when we release the official executive order, and the phone number and the email address that people can call in to report. Again, it is a last step. We will start with education, and that's why we're holding this press conference today, to alert people that is no longer just a recommendation. It's actually mandatory when you enter in a public building indoors. You need to be wearing a mask whether or not you are vaccinated.
Just a quick follow-up, if I may. Have you reached out at all to the business community? Is there any kind of a buy-in from that standpoint? And we have the big box retailers, and there's different levels of acceptance for this. I think historically, what if anything have they said to you?
We've received a lot of feedback over the last month since the governor declared the state of Oregon was open again, and yet people saw the numbers increasing. Fear and confusion was, I would say, the dominant factors in our community. So we've heard from a lot of individual businesses, from a lot of business collaboratives, that having a clear, consistent, concise message is what is most important. And that it was very difficult for them to enforce these rules on their own. They wanted the state, preferably, but at least at the county level, to have a consistent message. So that's what we're doing today.
Lisa with Coin, please do.
Yes, thank you. Chair Kafoury, what's the conversation been with the governor relative to asking for a statewide mask mandate to make this a lot, quote unquote, easier on counties?
I respect that the governor is in a difficult position with having 36 counties with varying levels of vaccination, varying levels of buy-in from elected officials, from businesses, and from community members. So I can say that she's well aware of what Multnomah County is doing and supports our efforts. And I would actually support other counties coming forward now that the governor has said that this is something that's going to be a county by county level. I would support, my sister counties around the state. It's not just Multnomah County that's dealing with the Delta variant. It's every county in our state.
Have you urged her to put back in the statewide mask mandate?
I have urged her to look at all the tools available to ensure that we can keep our community members safe.
But did you ask her specifically to put the statewide mandate back in?
No, I asked her, I told her that we were going to be doing it in Multnomah County and that we would like her support, and she said yes.
Thank you so much. Kelly Azar at K2.
Hi, yes, thank you for taking our questions today. My question has to do with the length of time this mandate is going to be in place. We're hearing that it could be up until January. What will you be looking for at that point, or even along the way, in order to hopefully at some point reverse this mandate or even extend it? What are you looking at, and what's kind of the benchmarks for us?
Yeah, so I'll take this question. Thanks, Kelly. This is Jennifer Vines, the Multnomah County Health Officer. We put an end date of January 2022 on this. That's to account for a few things. The first is, follows the typical respiratory season. We want to make sure our kids get back to school in a good start. I think as immunity increases, and we're going to need higher levels now that we have a more contagious COVID-19 virus circulating, but as immunity levels go up, hopefully through vaccination and not through infection, then we may be able to peel back this mandate before January. But I think this is an example of how we need to stay really flexible and really alert to how this virus is behaving globally and anticipating what we're going to need to put in place to keep our local communities healthy.
Thank you.
Rachel Monaghan at Willamette Week.
Hi, thank you. This is a question for Chair Kafoury, and perhaps, we'll stick to Chair Kafoury. Are you going to implement a mandate for other county workers who don't have an exemption under state law for employee issued mandate, vaccine mandate?
So we are exploring all the options available to us at this time. I think, as you highlighted, there are some difficulties with a vaccine mandate at this time, even just as an employer, because so many of our employees are covered by the vaccine exemption. I have asked the governor to add other job classifications that are included in that mandate or that exemption to be removed, and I would like assistance from the legislature to help make that possible. That being said, we know that there are other hurdles to address before that happens, and I'm really hopeful that this mask mandate will get us further towards our end goal of getting people vaccinated in the community through the safe, easy, effective, and free vaccines that are available in our community.
I just want to clarify one thing there. Are you saying you support repealing that 1989 law?
Yes, I do.
Thank you.
Julia Silverman?
Yeah, thank you so much. I have a similar question for Superintendent Guerrero. I am wondering if there's any conversation about vaccine mandates for school employees. And yes, and then I have a quick follow-up when you're done.
Thank you. That's a great question. What we know is that we widely promoted and made available the opportunity for not just our educators, but all of our district staff to get vaccinated. And the vast majority we know have gone ahead and taken that important step. We haven't made a decision about mandating it. There are probably some exceptions with employees who have some legitimate reasons for perhaps why they can't participate in taking the vaccine. But at this point in time, we haven't talked about a mandate for the adults in the system.
And will you be telling parents X percentage of teachers in your school or employees in your school are vaccinated? I understand you can't say specifically this teacher is, but will you be able to give parents an overall estimate? Because, I mean, correct me, one of the doctors if I'm wrong, but we do know that vaccinated adults are the best way to protect unvaccinated kids, correct? Yes, lots of nods.
Yeah, I think that's right. We do know the percentage we would find to be very high across adults in the school system. There's been a significant uptake. We're talking with all of our labor groups around perhaps initiating a voluntary indication by our employees to try to survey who among us, what percentages can we offer some assurance have in fact taken the vaccine.
Julia, did you have a follow-up?
I did, if that's okay. I wanted to go back to the question that Dr. Vines answered. You talked about extending this through January, and perhaps if immunity increases before then, we might be able to roll it back sooner. Can you be any bit more specific on the metrics you might use, like 85% vaccinated, or if our hospitalization caseloads go down to, say, 5 for every 100,000 person? Any specificity on metrics?
I don't have a lot more specificity at this point. We are trying to define those thresholds because we understand it's important for people to understand like what is the milepost. I feel pretty confident in saying that I don't think this is forever. I do think that we're on a steep upward climb, and we really want people immune by virtue of vaccination and not by infection, because that's what's going to overload our hospitals and risk our recovery pathway for schools and businesses. So I don't have a specific benchmark for you, but it's something that we are trying to get a sense of so that people can see the results of their progress and their efforts.
Thanks so much. Ted Sickinger with the Oregonian. All you, Ted.
Apparently he doesn't have a question.
Yeah, I'm sorry about that. Thank you. I'm wondering if this situation is so dire, why not start this immediately? What good does this do if Washington and Clackamas County are not joining us? And 3, if this doesn't have the desired effect, and maybe there are different folks who answer these, would you consider going back, or are you considering going back to more capacity limitations and other restrictions that were around earlier in the pandemic?
Can you remind us what the first question was, please?
Yeah, why not do this immediately? Why are we waiting till Friday? I mean,
Sure. Well, we know that it's going to take a while to get the word out, and again, that's why we're having this press conference today, because we want to ensure that before people start reporting businesses for violating these procedures, that we have had ample opportunity to get the word out. We will be distributing through our communications team flyers and collateral so that businesses will have the appropriate displays, and then just that there's time that people can get prepared for going back to something that we had in place earlier.
So what good does this do if Washington and Clackamas County are not joining us in this effort? And what, have you made a request that they do so?
I will ask one of the doctors to weigh in on what good this does here. I believe that I would love for Washington and Clackamas counties to join. We've been working very close throughout this pandemic. And I think that it is Multnomah County doing this as a first step. And I'd love to see my partners join.
Thank you.
Sure, I'll just, I was just going to jump in and just reiterate what Chair Kafoury said. I think this shows that we're serious.
Ted, you need to mute yourself.
For how other counties may consider a similar mandate. That said, we are responsible for our constituents, and we can see here the strong support for this step today. So we can't speak today for Washington and Clackamas counties, but we can at least be very clear on Multnomah County's stance as far as the moment that we're in right now.
Okay. So if this does not have the desired effect of stemming spread, at what point would you consider further capacity limits or some of the other restrictions that were around earlier in the pandemic?
I think Dr. Vines talked about the metrics that we're still in development for. We realize that we don't have all of the answers today, but we believe that this masking step is so important that announcing it immediately was the best line of defense at this moment. We're exploring all other options, and hopefully this will help us stem the tide. But if it doesn't, we are open to considering other options to save people's lives.
Thank you so much. Zach Morris, the Northwest PDX Examiner.
Hi, good afternoon. This question is for the superintendent. Do you have a metric set for a certain case positivity rate where you would think about going back to CDL or hybrid study hall learning? And then I have a follow-up after that.
Sure. I don't see your face on the screen. It'd be good to know who's behind all those social media posts, but thanks for the question. Look, and I value, I understand that you have a particular perspective. The challenge for any leader is balancing the perspectives of 50,000 families and 9,000 employees. And as you heard me say earlier, making sure that we remain guided by our public health experts, many of whom that you see on the screen here. And so all along, you have seen us try to, be guided by some of those indicators that signal to us that we can move into another phase. And you've seen that throughout this pandemic as we've shifted our service delivery model from being completely distance learning to going into hybrid to saying to our families, and now here's a further choice we can offer. And what we have heard is loud and clear, our parents want their students back in school. And for those who can't, or for whatever reason, want to exercise a different choice, we've also gone through a pretty heavy lift of making sure we offer a virtual school option for those that are interested. And surprisingly, actually, there hasn't been a large interest, but we're going to try to get everybody who wants that option there. As far as metrics for when we may need to pivot again and adapt, that's largely going to depend on our public health experts, many of whom are on the screen, and we're going to continue to be mindful of guidance from the Oregon Department of Ed. We're trying to follow the resiliency framework that they've updated to the letter. I think PPS will be an exemplar of that, and we'll continue to deliberate any whatever guidance comes our way, and to see if any shifts make sense. My hope, I'll want to remain optimistic, is that if we all adopt these safety measures, that things will improve.
fingers crossed. A follow-up question. School sports will be starting in the next few weeks for Portland Public Schools indoor and outdoor sports. For indoor sports, will masks be mandated or required while a kid is in a gym? Some high schools still do not have air conditioning where the temperatures could be over 100 degrees. Is that safe for a kid to be wearing a mask while playing a sport? Thank you for your time.
Well, school district leaders are certainly working with OSAA, who sort of regulates athletics across school systems. We have received their initial guidance around masks to be worn. In some cases during competition, that could present a hazard, strangulation during wrestling. It's kind of hard to wear your mask during swimming, things like that. But I think wherever possible, when students are not competing, we'll ask them to wear their mask as they have been doing.
Thanks so much. We've got time for one more question. Erin Ross with OPB.
Hi, my question is for Superintendent Guerrero. Is there anywhere that we can find information on the progress that has been made so far at increasing ventilation in schools? That's been a continuing issue since the pandemic began, but it's been very unclear what progress has been made and what steps there still are to be taken.
Sure. What the community can continue to expect on an almost daily basis, information very transparently and to great detail is being posted on our website. Already over the last year and a half, there have been a great deal of improvements to try to maximize ventilation and air quality. That includes maintaining our HVAC systems on all the time, changing out filters to higher quality MERV or HVAC or HEPA quality. We've installed industrial strength HEPA filters in every single learning space across the school system. So we're pretty confident that the air quality is better than it's ever been. And we're continuing, and that includes other measures, keeping windows open, doors open, et cetera, to try to keep the airflow as optimal as possible. On our Back to School 2021, you will notice for each of our layered health and safety measures, details about what that looks in practical ways at our school site, as well as links to all of our standard operating protocols. And you can find many of the details related to each of these measures there.
And do you believe that that with those measures, 3 feet of physical distancing for a full capacity school will be enough to prevent transmission among students, even given the transmissibility of the Delta variant?
Well, I think we're all relying on our public health experts, CDC, APA, our American Pediatrics, but ODE saying that schools, the guidance and the recommendation is to try to maintain that 3 foot of physical distancing, and that's what we're doing wherever possible.
Thank you.
I want to thank everyone for joining us today. And just as a little side note, I just got a text from my hairdresser who said, as a small business owner, I want to thank you for this new mask mandate. So businesses are appreciative of our direction and guidance. And then if you have other questions or comments, please reach out to Kate or to Julie, and they will connect you with any of the speakers from today's press conference. Thank you so much. Stay healthy and stay safe.
All right, if there's anyone listening with me, we're going to listen to the beginning I missed and the part before. Oh, and yeah, there's a man dead after a Try My Best shooting on Hawthorne. Should we watch that? Shot on the bus. Like, I take that bus. And of course, it's going to play another ad first. Let's skip the ad.
They say a man died after a shooting on a TriMet bus. It happened late this afternoon near Southeast 26th and Hawthorne. Police say there was a disturbance on the bus before the shooting, but they aren't elaborating on what exactly led up to it. The victim died at the hospital, and the shooter left before police arrived. Southeast Hawthorne is closed between 26th and 29th Avenues while police investigate. We spoke with a neighbor who says, unfortunately, she's gotten used to this kind of violence nearby.
Honestly, it was not that surprising. This particular block in general is very active with a lot of crime, and there's always police cars.
This marks Portland's 56th homicide of the year, according to the Oregonian, surpassing last year's total of 55 homicides. That also makes this year the deadliest in the city since 1994.
All right, let me see if I can get back to the one we were watching. And yes, I am eating chips, and yes, I did yell at the computer when it played an ad when I was trying to watch a live press conference because I am particularly frustrated today. But let me see if I can get back to the previous broadcast and we can listen to the beginning of it. And of course, it's going to play another ad first because apparently the ads are even more important than live news. But this is a replay at this point. So let's just skip the ad and try to stay calm. And
pediatrics, but ODE saying that schools, the guidance and the recommendation is to try to maintain that 3 foot of physical distancing, and that's what we're doing.
That is not the beginning.
Thank you.
Pediatrics, but ODE saying that schools, the guidance and the recommendation.
Let me
is
see if
to,
I can find
try
a
to
feed with
maintain
the
that 3 foot of
beginning. Portland nonprofit that distributes fresh fruit to the community in need of what? What kind of an ad is that? Attention patriots to illegal immigrants, and they didn't even spell illegal right?
All know about the fresh
Deserve
fruit
to
this
have
time of
stimulus
year
checks?
in Oregon and Southwest Washington. A lot of people enjoying that right now.
Or maybe
So
they
here's
did
the deal.
spell it right.
If you have a fruit tree in your backyard, maybe some fruit trees, multiple fruit trees, and you've got a lot of fruit on the ground, there's actually a nonprofit that wants to help you out in collecting that fruit. KHW's Brian Clerkley is live with us this morning to talk more about what's known as the Portland Fruit Tree Project. Good morning there, Brian.
That's right, and good morning, Drew. They've been harvesting donated fruit for the past 15 years, anything from cherries to apples to pears, and they go to people's homes who have fruit trees, and then they harvest the fruit right there at the homes. And I got to see one of those harvests and see how it worked. Last year, they collected and gave out 11,000 pounds of fruit to people in need. And to distribute what they harvest, they work with a dozen different organizations, including the Senior Center. Organizers say it takes a lot of volunteers and donors to keep the Portland Fruit Tree Project going.
Membership is really important to us. We rely on those recurring donors who are able to help support us. Picking the fruit is wonderful, and it's not tremendously efficient, so it takes a lot of resources to make every harvest happen. Volunteers coming out is awesome. We've been really lucky in seeing a lot of volunteers.
And so far this year, they've collected about 1,500 pounds of fruit. And last week, I went out to a house in Southeast where volunteers were picking pears from a tree, and it looked like a pretty tedious task. And they expect to exceed that 11,000 pounds of fruit from last year. They've been getting a lot of donations. And if you want to donate some of your fruit, you can go to portlandfruit.com and fill out a registration, and you can get involved from there. Back to you guys.
Sounds good. All right, Brian. Thank you so much.
All right, let's see if we can. No, we don't want to watch that one. Let's see if I can find the one that we were watching, like to watch from the beginning. Let's try it again. But if it starts it in the middle again, I'll look for a feed from a different news station. There's no Wait, watch on YouTube. All right. Let's see if it starts at the. Let's see.
Thanks for your patience, everybody. So watch the tab. Julie, do you want to work on that while we get things started? Yes, let's go ahead and get started. So just chat with Julie if anybody still needs help, and we will we'll work. We'll just get started. So thank you for joining us. I'm here today with Chair Deborah Kafoury, Health Officer Dr. Jennifer Vines, Dr. Renee Edwards, the Chief Medical Officer of OHSU Health, Dr. Mary Giswold, Associate Medical Director for Northwest Permanente, Dr. Seth Podolsky, Chief Medical Officer at Legacy Health, Dr. Kevin Olson, Chief Executive for Clinical Programs at Providence, Portland Public Schools Superintendent Guadalupe Guerrero, and State Representative Dr. Maxine Dexter. Our speakers are going to say a few words, and then we'll turn it over to your questions, and then we just ask reporters to put their names in the chat so that we can take your requests in order. With that, I will mute myself and ask speakers who aren't speaking to just take up their video until they're up.
Good afternoon, everyone. Thank you so much for joining us on this call today. I'm Deborah Kafoury, your Multnomah County Chair, and I'm grateful to be joined today by the truly impressive healthcare leaders who have steered our collective fight against COVID-19. From our own Multnomah County Health Officer, Dr. Jennifer Vines, to leaders from the 4 major regional health systems who have been on the front lines during our darkest days. Doctors Edwards, Giswold, Podolsky, and Olson, in addition to treating COVID, you have built a remarkable collaboration to vaccinate our community. And I'm also honored to be joined by an educator and a state lawmaker, Superintendent Guerrero and Representative Dexter, both incredible partners who have worked tirelessly, sometimes thanklessly, to help our families and our community endure the immense challenges of the COVID-19 pandemic. While they've all seen firsthand the harms, disruption, and pain that so many have experienced over the last year and a half, our collaborators have also had a central role in helping our community make great progress against the virus. But with the emergence of the Delta variant, we are at risk of losing the gains that we've made together, which is why we've called this conference today. Today, I'm announcing an executive order that requires everyone 5 years of age or older to wear a face covering in all indoor public spaces, regardless of whether they have been vaccinated or not. This is in effect on Friday, August the 13th, and it will be enforced. We'll enforce this mandate like we do our tobacco regulations. The process will be complaint-driven and will involve a series of escalating steps from education on up to a $1,000 fine. And we'll be sharing more of that process later this week for the public to report issues either online or over the phone. Why are we taking this difficult step now? It's because we know that masks work. They are tried and true, they are affordable, and they're an effective way to limit the spread of this virus and its variants. And until enough of us are vaccinated all across Multnomah County, masks remain one of the best strategies that we have to keep each other as safe as possible. This executive order builds off Multnomah County Public Health's late July recommendation, which we made as we began to see a resurgence of COVID-19 cases fueled by more social activities and most notably by the Delta variant, which we know is much more transmissible. The variant has undeniably changed the terms of our engagement with this pandemic. This executive order represents an urgent, necessary pivot in what we can and must do as a community to slow the spread and save lives while we continue to get our community vaccinated. We've heard from many members of our community who have expressed support for the clarity gravity, and the enforcement of a mandate. Today's action brings consistency to expectations and minimizes confusion in the public indoor spaces across our county. But more importantly, it is a measure that we must take to protect each other, all of us, from a variant that is ripping through communities. It's a step we have to take to keep our kids safe, especially those who are too young to be vaccinated, as well as their teachers, as we get ready to send children back into classrooms next month. It's about keeping community members who remain vulnerable, including those who have not yet been vaccinated, protected as much as possible from severe illness that requires hospitalization, and in the process making sure that our hospitals have the capacity to help people experiencing other life-threatening circumstances. It's about protecting frontline workers, our family members, neighbors, and friends who perform work that is essential to keeping our community moving. We know that the widespread use of face coverings can and does work to bring cases down. But I want to be clear, the best, most effective step that people can take to protect themselves and to protect each other is to get fully vaccinated. The vaccine is safe and it works as it should. It prevents severe illness, hospitalizations, and death. And I also want to note that Multnomah County will be implementing the state of Oregon's vaccine mandate for healthcare workers to be vaccinated or to undergo weekly testing. Many of our employees, both in healthcare and elsewhere in our county, are fully immunized. And with that, I'll also want to note that I've asked the governor to broaden that mandate to include people who work in corrections and law enforcement. We are at a critical juncture in a pandemic shaped by community-altering moments. We have the tools, vaccines, and masks.
What the hell? Why did it stop in the middle?
The Hansons are going wherever the open road takes them, and no matter where they end up, they'll be about 10 minutes from a hotel by Wyndham, with over
Pediatrics, but ODE saying that schools, the guidance and the recommendation is to try to maintain that 3 foot of physical distancing, and that's what we're doing wherever possible.
Thank you. I want to thank everyone for joining us today. And just as a little side note, I just got a text from my hairdresser who said, as a small business,
Okay, I'm going to end this because I can't find it, but thank you for joining me.